GPT Health, a decent 15% premium is what it listed at. But let's understand a little bit more about the business with Anurag Tantia, who's the director, and Atul Tantia, the group CFO. Thank you so much, gentlemen, for taking time out. Atul, I'm going to start off with you. What kind of growth are you penciling in? Because your top line has seen a CAGR of about 14% in the last 3 years. Can we see an improvement in this number?
So just to clarify, our top line has grown by almost 19.5% CAGR over the last 3 years. And we expect with the hospitals coming on board in terms of newer hospital in Raipur as well as the existing hospitals, the occupancy ramping up, the growth should be in trend with what we have achieved earlier. Obviously, we can't give a number because of we are in the silent period already. So we will be able to interact more post the financial results for the third quarter, which will be declared in the next couple of weeks.
Good morning, gentlemen. And Atul, I actually want to continue with you as well. And when you see that you've already seen a work in progress that is to expand beyond the eastern region of India as well. And you have also signed an MOU in Chhattisgarh, Raipur, and those that are based in on the asset-light model. How much of incremental revenue are you expecting from these regions then?
So honestly, Chhattisgarh is eastern part of the country only. It's not away from our model of being in the eastern part of the country, which is quite underpenetrated for healthcare. Mature hospitals, when it achieves, I would say, an occupancy of about 70-odd%, would lead to a revenue of almost 100-odd crores. We expect hospitals to mature in 3 years post-commissioning. So that is the kind of revenue that a hospital can achieve, a 150-bed hospital. And that's what we would target.
And Anurag, when we compare you to some of the other listed players, your occupancy rate is low. Is there any reason for that? How do you see this number shaping up?
So our aggregated occupancy is at 60% mark. Our two mature hospitals in Calcutta are over the 75% occupancy, which is the optimum occupancy more or less. The occupancy overall is slightly understated on account of the new hospital in Howrah. It has just done its first year of non-COVID operations last year and is at 50% occupancy. As that hospital ramps up in the next couple of years, we should be getting it an aggregated occupancy level of around the 70% mark.
So the company as well, Anurag, generates more than 90% of revenue from private patients. It does not depend on occupancy from the government schemes or corporate tie-ups. Any change in this mix you see?
So our neighborhood nature of our hospitals really does not require us to depend on the government schemes or corporate business. Since we operate out of a densely populated neighborhood, we depend on the residents of that neighborhood who mostly end up paying in insurance and in cash. We don't seek out corporate or government business on that account. We look at a 5-kilometer radius for our functioning, which is mostly full of the people who are staying in that area and are easily able to pay through cash and insurance mediums.
And Anurag, how much is the international revenue contribution? What kind of growth prospects are you seeing from the neighboring countries?
So as I said earlier, we basically depend on the neighborhood hospital concept. We don't seek out patients beyond the 5-kilometer radius. So international borders tend to be slightly further away from on that account. However, that being said, for our Agartala hospital, we do get a significant amount of volume from Bangladesh because Bangladesh borders only 30-minute drive from the Agartala hospital. At this point, for our Agartala hospital, we get roughly around 10% of our volumes from Bangladesh. This, with logistic reasons opening up, there is a new visa center in the Bangladesh part of border close to Agartala as well. We expect a further increase in this volume down the line.
All right, good to have you on board and understand your business a little bit better. Thank you for joining in. Let's move on.